So I felt incredibly defeated and really was not sure if I had what it took to be this future doctor that I always aspired to be. And I think for me, the true epiphany and the true realization that this was not only my calling but my destiny was during that same sophomore year when I kind of hit my lowest of lows is when I found my highest of highs. I was in lecture and we had a guest lecturer who'd come in to talk to us about health disparities. This was a topic that was very, very broad that I was never really familiar with. And he kind of explained to us that the health of the patients that I would come to interact with in the hospital and the clinic, their health course starts way before the moment they come to the hospital. It starts as early as when they're in the womb as babies in their mom's stomachs. And it's the idea that what happens to the mom, the food that she eats, the stressful environment that she's in, the exercise that she does, all these things actually affects not only her health, but the health of her baby. And that at that moment you have these two trajectories of health, these two paths that people can take. And it's the environment that you create early on in someone's life. So the environment that they are born into that really can affect the health that you see when they're 50, 60, 70. And so I remember hearing this concept and realizing, wow, medicine is way more beyond just treating a disease. Here's a medication, here's a surgery. It's way more than just an instant cure. Medicine has the potential of changing social injustices. If a patient of mine has diabetes or hypertension because they live in a neighborhood that has no grocery stores, because the grocery store, the neighborhood is unsafe and grocery stores are, it's what they call kind of a food desert. It's my duty, it's my privilege as a physician to use the information that I've gathered through my medical training, the information I've gathered as being a doctor, and work with policymakers and work with government officials, work with grocery store owners, whoever I can to change that environment so that the health outcome I see in the hospital isn't that disparity between the rich and the poor, between minorities and majorities. I can do something about it. And so I remember when I heard about this concept of the health disparities, I went from a meager pre-med to a fired up